Our next speaker is Julie Phillips Pollack. Julie, Dr. Phillips. I'm sure you've heard over and over again that the worst thing that can happen to a parent, and I am a parent, is the death of your child, particularly a death that occurred so prematurely and senselessly. I am so sorry to have to repeat that truism today. I suspect that the spirit of your daughter, 18-year-old Meadow Pollack, is what inspires and strengthens you and your husband in doing all that you can to put an end to gun rampages that have occurred in way too many schools from places that are now, sadly, household names. Julie.
I'm here for Meadow, and I want to show her pictures. Oh, yes, I'm here for Meadow, and I want to show her pictures, but I wanted to mention to you the names of the other 16 people that were killed that day, and I've had a chance to speak to their families and meet them since that time. So they include Alyssa Alhadef, who's buried at the cemetery very close to where Meadow is, Scott Beagle, a teacher, Martin Duque Anguiano, Nicholas Doret, Aaron Feiss, and I'd like to say that he died a hero. He went in the building and used his body as a shield with nothing else. Jamie Guttenberg, Chris Hickson, he was another hero, another coach that went in unarmed. Luke Hoyer, Kara Lofgren, and I'd like to say about Kara Lofgren that she and Meadow were trapped together on the 3rd floor. Meadow had been shot 4 times, and she was stuck outside of a classroom. All the classroom doors had been locked, and she was stuck in the hallway. And she laid over the top of Kara, who hadn't been shot yet. And he came and shot her, both of them together 5 more times, killing them both. Gina Montalto, Joaquin Oliver, Elena Petty, Meadow Pollack, Helena Ramsey, Alexander Schachter, Carmen Schintrup, and Peter Wing. So I'd just like to go through some of the pictures here. This is a picture of Meadow with her grandmother. We all went on a family cruise for her 80th birthday. And this is her grandfather that had died a few years ago. They had a very close relationship. And her brother Hunter, and her cousin Becca. And family vacation. We were at the Cabbage Patch Kids Museum in Georgia and at a hockey game. And San Francisco, obviously, Hunter. One of our favorite ice cream places, and this is her brother Huck in the picture as well, and her father. And this is a picture of her with her father. I think I have a few more of those. Andrew, different times, Meadow and Andrew. And this is something that was put together. Her cousins and friends made collages and pictures and had decorated these rocks, and that was displayed in our house during the Shiva. More pictures of Meadow. This was before homecoming. And this is all of us cooking in the kitchen. And this is a picture of Meadow with her brothers and cousins. And this is how she lived all the time surrounded by her family. And I just wanted to end with this picture. This is a picture of her boyfriend, Brandon. This was right at the end of the funeral. So I'm here as Meadow Pollack's stepmom. I'm just one of the many people that love her. She is a beautiful 18-year-old girl. She had an amazing family. She had great parents, grandparents, 2 brothers, a stepsister, and many aunts and uncles, cousins. She had close friends. She had a boyfriend of 4 years that you saw there, Brandon, and really her entire community loves her. She planned on going to Lynn University, and she had many more plans to the future beyond that. So in my work as an emergency physician, I work in a level 1 trauma center and trained in a level 1 trauma center. And over again, I witness the effects of violence and I treat the effects of violence. And too many times, I've had to tell other parents that their child was murdered and that they didn't survive. Usually it's easier. I maintain a clinical detachment. It lets me go back a few minutes later and treat my other patients that are alive. So you just have to keep going. Before this, I'd never really been personally affected by violence. So really, none of us were prepared for this, not at all. So in the past, I had tried to advise the girls how to take care of themselves. For Hanukkah, I had just given Meadow one of those loud personal alarms to use. I would tell her where she should park if she was by herself at night. I prayed none of the kids would have a serious car accident, but this type of thing wasn't on our radar at all. So the day that all of our lives were forever changed, it was Valentine's Day. My husband and I were out on a bike ride, and we started getting phone calls that there was a shooting at Douglas. And initially I thought, there's no way it could be Meadow. What are the odds it could be her at a school? It's so big, like 3,100 students there. How could it possibly be her? And then the slow torture started. It lasted 13 hours while we waited for the final confirmation. I was searching the trauma centers where I worked and calling my coworkers, sending them pictures, hoping that we would find her at the hospital. I started to really worry when a good friend of mine, I spoke to him, he's a director for EMS. He called and told me about all the bodies that were still in the school on the floor that he was looking at. And as the hours went by, we knew that she had to be there. So we had all hoped that Meadow had just lost her phone or was detained somewhere in all of this. But then as the time went by, we knew that it had to be more than that. So suddenly, I had to develop a new logistical framework. So how do I tell her grandmother there that she recently lost her husband, that that's probably where Meadow was too, and that I would send a car for her to come be with us? And when do you tell her brother and her cousin who are away in college that they should start coming home to be with us? Because we knew after so much time had gone that it had to be her. And then I wish that I could, but somehow even slightly or temporarily relieve the pain that I was watching her mother go through. The mental anguish is just like physically difficult to watch. So then the day after the shooting, it brought more logistical type of questions. How did we get the body released from the medical examiner? When should we have the funeral? Where should we pick for a cemetery? And then as we walked around the cemetery, we had to pick a spot. And how do you pick the best plot? I don't know, but thankfully our rabbi was there constantly with us, and he kind of guided us through this time and sorted through those decisions that nobody wants to have to make. So to begin with, we were aware of what happened to us, but it was hard to imagine what had happened to other people, and it was hard to even imagine that there was something more going on than what we were experiencing. But during the Shiva, we had thousands of people come to our house. I started talking to other families, and I listened to how they made their funeral arrangements and met their children that were surviving children and how they were reacting to their own loss. And thousands of people came to our house to honor Meadow. Some of them I don't even know, most of them we did. And our family really pulled together to care for each other. So a lot of volunteers donated their time, and it was really a collective effort. And the pictures there, you saw that they had the balloons and the decorations and things that we had at our house. So many of Meadow's friends and schoolmates, they gathered at our house at the Shiva and then after. And I started talking to them about their experiences similar to what Lauren had. And their fear of returning to school was really palpable. And for the first time, I hadn't thought of it too much before, I realized how vulnerable our kids are, and that this wasn't the first school shooting. A good friend of mine from medical school, she was at the shooting in Paducah, Kentucky, that was 20 years ago now, and I spoke to her, and it really broke my heart that 20 years later that this was happening, and I hadn't even thought about it, or thought of it, that it could be something that we could live through. So it begs the question, why do we allow it? And as I listened to the students that were in my community, that were there at my house, that were afraid to go back to school, they were just asking for somebody to tell them that they're safe. And literally, they were begging for their lives. So I think that we do have to face the ugly reality that children aren't safe in schools. And there's going to be predators that don't respect school boundaries. Like in this case, his goal was to maximize casualties, like he was in a video game. So it's not fair for a student to have to worry that she could be hunted and murdered in the hallway like Meadow was. How can a student focus on learning, and how can a teacher focus on educating when they're worried this can happen to them? It's just as big of a problem for the teachers, that they're secure as well. So in the past month, I focused my energy on the issue of safety in school. When you lose a child, there's no sleeping. So I'm fueled by the injustice of Meadow's death, especially after I've learned that there are over 200 previous school shootings, and I understand up to 300, and it depends on how you calculate the numbers. Since then, I've listened to students, parents, teachers, and law enforcement. I spoke to parents from Columbine and Sandy Hook, and I read their research and their proposals. And my husband and I have been doing a lot of work trying to understand this and see what we can do to improve things. And in that time, we've met with Secretaries of Education, Health and Human Services, and Homeland Security, a few U.S. senators, and with the president. And in Florida, I spoke to Governor Scott and several state legislators. And I do feel the lawmakers are listening and that things are being changed. So in Florida, I'm very proud to say that my family with other families went to Tallahassee and worked to help pass the Safety Bill 7026. I do think it is an important bill. Like, no bill is ever perfect, but it's a comprehensive bill. It includes funding for school hardening. There was reasonable gun control measures in it. It includes threat assessment, like Dr. Cornell had mentioned. Also access to mental health in schools, like Lauren had mentioned. That's a big part of it. They went to have a mental health person at each school. Right now, the counselors are really there just for career guidance. They're not mental health experts. It also improves communication between DCF and the police and the schools, so that's important because there's been a lack of communication in this instance in particular. So it's a start. So in my work as an emergency physician, we treat critical patients in a systematic manner. We first assess A, airway, then B, breathing, then C, circulation. We then move to treat the acute condition. So later down the line, we consider secondary prevention, which is treatment of early disease, such as diabetes. And then lastly, but not at all least importantly, primary prevention, such as diet and vaccination. And that's what public health is all about, like what we're discussing here. So I feel that we need to apply a similar strategy here. So our ABCs in this situation are security. I feel like we do need to have a secure perimeter, similar to how Sandy Hook was built. I think it's way too easy to walk on campuses in America with a weapon of some kind, a gun or whatever else. And it's time for the security analysis to evaluate the security that we have here and implement changes that would make the school more like entering a courthouse. It doesn't have to be a fortress. You don't have to have armed security at every door, but it could be similar to this building that we walked in here. Even a little less security. If there was maybe at the school just a few cameras, if there was a entrance and exit, and a few things. I'm not a security expert, but the Department of Homeland Security is willing to go to the schools and make some recommendations. So I think after the teachers and students are secured, the focus can turn to secondary prevention, such as treating the school environment, like the mental health initiatives. And then lastly, we can address primary prevention that treats society as a whole. So what I've sadly witnessed over the last 20 years is the debate on gun control after each shooting, which is a valid question, but this approach has done nothing to secure our kids. This lack of action is what killed Meadow. So I believe that gun control is an important topic and it should be included in the discussion of primary prevention, But I do not believe that we should let politics and bureaucracy stand in the way of securing our schools again. So I've heard people describe here that they're concerned that spending money on security could take away from funding for mental health. But I think that we don't have to compromise. I think that we can have both and that our children are worth it. People ask me every day if there's something that they can do. And what we can all do is not allow this to happen again. There wouldn't be a better way to honor Meadow and the other 16 people that were killed that day. And I appreciate everybody being here. I think an important aspect of the secondary prevention is the mental health measures that we've all been talking about today, with social work, mental health, and then in primary prevention with gun control measures. And I appreciate everybody having me here.